Hamstring Injury and Training Workshop, Module Hamstring Theory. So the objectives of this module are to have an understanding of the incident rates, risk factors, pathophysiology and mechanics of hamstring injury, and to understand how researchers approach the concept of hamstring strengthening and rehabilitation through the use of different modalities. To also understand how strength imbalances can affect the occurrence rate and reoccurrence rate in sports. After observation of this presentation, you should then complete the review questions for this module. So just a few questions about hamstrings that we'll look to try and address throughout this presentation, to include which hamstring muscles get injured the most, how many hamstring muscles are there, do most hamstring injuries occur at low or high speed, how do they compare with ACL injuries, what are the risk factors for hamstring injuries, how can strengthening help and what type of exercises are prescribed, and which demographic groups should be targeted with hamstring specific training. So hamstring injuries are the single most common injury in professional football and the second most common injury in rugby. In rugby, the incidence is higher in backs than it is in forwards. In fact, it's the most common non-contact match injury in backs. Hamstring injuries account for, on average, about 10-15% of total injuries per season across multiple sports. So here we see some of these incident rates for across different sports. So soccer, or in the UK we would call it football, it'd account for about 12% of all injuries. Rugby union is somewhere between about 6 to 15%. Cricket 11%, basketball about 6%, American football about 13%, and Australian football about 16%. So what do these injury incident rates actually mean? Well, in Australian football, that would equate to about 21 missed matches per club per season. In Premier League football, that equates to about 15 missed matches or 90 missed days per squad per season. And the average return to playing from hamstring injury for a grade 1 strain would be about 15 days plus or minus 3 days. So in a study of 20 Champions League football teams, out of the 600 injuries, 65% of them were hamstrings, 35% quadriceps. And when we're looking at the kind of different injuries and where they actually occur, 80% of these hamstring injuries were the biceps femoris. 60% occurred within matches, occurred at speed. So from that we can kind of get an idea about the mechanism of these injuries. Majority, or 2/3 of them, are speed related, and the large majority of them are going to affect the lateral hamstring, the biceps femoris. So why is the biceps femoris injured the most? Well, because most injuries occur at speed, and the long head of the biceps femoris is very much a speed producer, and that's where we see that relationship. So when we're looking at the injury reoccurrence, well, hamstring injuries are generally low frequency, although they are higher frequency than certain other injuries, but they do have a high reoccurrence. So hamstring injury reoccurrence is somewhere between about 12 to 63%, depending on the study that you're looking at. Previously injured players have more than twice as much risk as sustaining a new injury, and the risk for injury reoccurrence is elevated for 12 months after return to playing, with the first month of after return to playing being at the greatest risk. Now, just a quick bit on muscle strains, for those of you that aren't familiar with the term. So what is a muscle strain? Effectively, it's a disruption of the muscle tissue, and it's graded by its severity with a few different kind of categorization systems. So this is the one we're going to go through. So a grade 1 or mild strain, there's pain but no loss of strength. Grade 2 or moderate strain has a loss of strength and pain with restricted contraction. And a grade 3 or severe muscle strain would equate to a rupture of the muscle and complete loss of strength and function. So what are the risk factors for hamstring injury? Well, the ones listed are all the ones that are usually discussed. The top 3 are the ones in bold. So advanced age, so the older you get, the greater your risk of hamstring injury. Now, whether that's due to a decrease in kind of fast twitch fibers as we get older, not entirely sure, but what we do see is there is a correlation between advanced age and hamstring injury. Previous injury, as we've already discussed, is a major one, so the risk of reoccurrence if you've already had a hamstring injury is much greater. And a lack of strength has been well correlated with hamstring injuries. So if you have weak knee flexors, hip extensors with your hamstrings, then that does increase the risk of you pulling a hamstring. Race, flexibility, proprioception, the neuromyofascia, lumbo-pelvic stability, joint dysfunction, lack of a warm-up or poor warm-up, fatigue, low fitness levels, and the type of training you do have all been studied, but all have a relatively low correlation. So it's not to say that they don't have factors associated with hamstring injury, but the research doesn't necessarily support a high correlation. So main two activities that we will see associated with injuries, high speed running, as we kind of said, a large proportion of the hamstring injuries are associated with the long head of the biceps femoris. So high speed running, you're generally going to see a proximal long head of biceps femoris injury. It's also looking at, or it can occur with movements leading to excessive lengthening. So it's maybe where you are kicking high or sliding tackle, you inadvertently do the splits, and again that is also linked, one of the major kind of ways that people will pull their hamstring. So as a fitness professional, what is your role within this area? Well, the roles of the personal trainer and physiotherapist will have a partial overlap between the injured and healthy states. So your clients may well be healthy, they may not necessarily have had a hamstring injury, yet you can still utilize some of the stuff that we'll go through within these presentations to try to help limit the chances of them actually having a hamstring injury. Or you may be dealing or working with a physiotherapist with a client that has been injured. The physiotherapist will deal with the initial rehabilitation and then may pass them over to you to continue that strengthening in the long term. So it is quite important you kind of know what your role is for your vocation. So a physiotherapist will deal with the assessment, the diagnosis, and the rehabilitation of hamstring injuries. If a client has not seen a physiotherapist and has had an injury, then it is best to refer them. Your role will be to work with the physiotherapist in the application of latter stage rehabilitation, exercise implementation. Obviously, understanding the biomechanics and risk factors of hamstring injuries will help with the prevention occurrence or reoccurrence, and it will help to hopefully reduce the risk, but it will never eradicate the risk of actually having. So let's go through some of our hamstring anatomy. Well, to start off with, nice and basic, we have our medial and lateral hamstrings. So our medial hamstrings are made up of our semitendinosus and semimembranosus. Semitendinosus, as we see there, kind of sits on top of the semimembranosus. The lateral hamstrings then are the biceps femoris. So if we look at the hamstrings from an angle now, or a lateral angle, we can kind of see the short head of the biceps, which sits below the long head, and is a single joint muscle. So this just goes over the knee joint, isn't involved in hip extension, but we kind of need to look at it from the side to really get a good view of the muscle. So if we have a look at each of the hamstrings one at a time, first up is our semimembranosus. This has 5 attachments to the knee joint and a broad attachment at the hip. Plays a large part in knee stability and change of direction and works synergistically with the popliteus. Controls excessive tibial external rotation, which will have a link with patellofemoral strain. And just based on the shape of the muscle, gives us an indication of its function. So this is very much a force producer, has a large cross-sectional area, which means it will produce a higher peak muscle force than some of our other hamstrings. So if we watch the video, you can kind of have a little fly through. So here we can kind of see it from a few different angles. So as we said, it's It's going to sit beneath the semitendinosus, but it does have, like I said, a large amount of muscle bulk. So alongside the semitendinosus will form our medial hamstring group. Now the semitendinosus, then the other medial hamstring, is a muscle with a much longer tendon and less tendon slack. Shares a tendon origin with the long head of the biceps femoris at the hip, and is very much the kind of elastic hamstring. Alongside the kind of tendon description, does have much straighter fiber orientation, which would lend itself to being much more elastic. So in order to kind of train this muscle, if you load it fast, then you're going to create a much greater elastic response. And the faster you load it, the springier this muscle is going to become. So if we're looking at trying to preferentially recruit this one, then we're going to look to choose some of our faster, more reactive style exercises. So again, we'll have a quick fly around just so you can have a look. So this, as I said, sits on pretty much on top of the semimembranosus. And a much more, like I said, tendon looking type of muscle, so much kind of thinner and, as we said, longer tendon lengths. Now we have our lateral hamstring, so our biceps femoris, and the long head then, it's going to, as we said, share a tendon origin with the semitendinosus at the hip, and is very much the most commonly injured of the hamstring group proximally. It may also may become injured due to weak semitendinosus or even a weak adductor magnus. So just because your biceps femoris, the long head of the biceps femoris has become injured, doesn't necessarily mean it's always due to a weakness. Sometimes it just may be doing some of the work of some of the other hamstrings, and training our medial hamstrings or our adductors may also help to decrease the stress on this muscle and thereby help to reduce the incidence risk or the reoccurrence of an injury. The biceps femoris long head, very much a speed producer if we're looking at describing it. So here we have again our quick look around, just looking at it from a number of different angles so you can get an idea. So attaching onto the hip and then going down onto and past the knee joint. So this forms our lateral hamstring group. And then we have our biceps femoris, the short head in this case. And this is where the question that we asked on how many hamstrings do you have may come into question from what you've learnt previously. So in strictest evaluation, the biceps femoris short head should really be considered the fourth hamstring and separate, or a separate muscle from the long head. The short head of the biceps femoris is not activated by the sciatic nerve, of which the long head is. It's actually the common perineal nerve. So it's activated by a different nerve, which is one way of kind of saying you should classify it as a different muscle. It also has a different fiber orientation, so it's more oblique than the long head. So with a different fiber orientation and a different nerve activation, those are two very good reasons for actually classifying it as a separate muscle. This is very much a force producer, so with its kind of pinnated fiber orientation and short fiber length, it's excellent at producing force, in this case kind of a knee flexion force, since it doesn't go over the hip and therefore is not involved in hip extension. So if we have a quick fly around just so we can get an idea about what it looks like. So again, kind of lateral hamstring, but in this case a short pinnated muscle going over the knee joint, the kind of lateral part of the knee joint, heavily involved in force production of knee flexion. So, short head of the bicep with our fourth hamstring muscle. The adductor magnus could be considered our fifth hamstring muscle. It's a hip extensor and is also, by a few mechanisms actually involved in knee flexion and heavily activated during gait. So the adductor magnus, which commonly gets shortened to kind of AM, will help to reduce the stress on the proximal tendon and the medial hamstrings if strong enough. And therefore you could kind of argue that a medial hamstring tear could be partially due to overcompensating for a weak adductor magnus. Also, it's quite important at helping to reduce the stress on the lateral or long head of the biceps femoris, and so a strong adductor plays a big part in helping to reduce our risk of hamstring injuries. So let's have a quick look where this is. So as you see, it's a big muscle, hence the name magnus, and as we said, there's a large involvement in hip extension. So quite an undertrained muscle with a lot of people. So it may well be that a lot of our hamstring injuries could be related, or at least partially related, to kind of overcompensating for a weak adductor magnus. So this is one of the key things we'd look at doing with our hamstring training aspect, is making sure that our adductors are strong enough. So associated muscles, well, the hamstrings form part of the superficial backline, which is kind of, if you look at the Thomas Myers anatomy trains or kind of work by Ida Rolf, this is where these groups of muscles show how they kind of work together in teams. So one of these teams is called the superficial backline, and hamstrings form part of this, and as such are fascially linked with the other muscles of this myofascial train, or myofascial line, which are the erector spinae, the gastrocnemius, and the plantar fascia. Hamstring length will therefore be affected by myofascial adhesions within any of those muscles. It will also be affected by an anterior pelvic tilt, which in itself would be affected by anterior core and hip flexor, strength and immobility, and also by a lateral pelvic tilt, which would be affected by lateral core muscles, quadratus lumborum, adductors and abductor strength ratios. So the hamstrings need to be in balance with the knee extensors for knee stability as well. So what we tend to find is that a lot of people have quite strong quadricep muscles, and in comparison their knee flexors are quite weak in relation to what they should be, and that does compromise our knee stability. Hamstrings will also work with the other hip extensors to produce that movement, which, as we said, will include the adductor magnus, the glutes, and even the latissimus dorsi. So if your hamstrings are not as mobile as they should be, or not as compliant, or are doing the job of some of these other muscles, then it's not really that unusual that they may be a source of stress, and therefore. So as a very basic overview, it's by no means comprehensive, but as a basic overview, we may well want to mobilize tight erector spinae, gastrocnemius, plantar fascia, rectus femoris and iliopsoas. That's not, like I said, concrete. Sometimes to help hamstrings you may need to mobilize the erector spinae, sometimes you actually may need to strengthen them. So it kind of does depend on the individual. As a general rule, again, we may want to strengthen the glute max, obliques, contralateral latissimus dorsi and adductor magnus. But again, fascial adhesions within glutes and latissimus dorsi may mean you want to focus on mobilizing them more. So it does depend on the individual, but as a general overview, that should be helpful for you. So the hamstrings are involved in hip extension, which we can see with a little video here. So any of the hamstring muscles that go over the kind of hip joint, obviously linking in with the glutes and the adductor magnus, are going to help to produce this extension movement. And a lot of the stuff that we talk about is going to be in relation to gait, or in particular fast running, since that is a mechanism for why a lot of people will pull their hamstrings. So in relation to hip extension and how it works functionally, so hip extension is going to be used for forward propulsion. As you bring your leg back and the foot is in contact with the ground, that's what propels your body forward. Obviously this is helped with your glute max, adductor longus and magnus, and your hamstrings. And hamstrings do play an important part in helping to produce the highest speed levels. Eccentric hip flexion, so as you're running and your thigh is swinging forward, it will help to decelerate the thigh in the terminal swing phase of running, so as that foot's not in contact with the floor. And the hip extensors will also be heavily affected or will heavily affect pelvic stability as well. Hip extension, controlling passive hip flexion due to ground reaction forces on foot strike is another mechanism where these hip extensors do need to be working quite well. So what this means is as your foot hits the ground during the kind of foot strike in running, the ground reaction forces as a result of that foot strike are trying to bend the knee and almost kind of take you into like a bit of a kind of squat type movement with that knee. Strangely enough, when the foot is kind of touching or in contact with the ground then, and this closed chain position as it is when we are running, randomly your hamstring actually becomes a knee extensor, and that's what that term at the end means. It's an isometric paradoxical knee extensor. So we would normally say your hamstring is involved in knee flexion, which is pretty standard. So how can it be a knee extensor? Well, when your foot is in contact with the ground, as your hamstrings try to limit this flexion of the knee, because we don't want the knee kind of flying up towards the hip, as you extend the hip with your foot touching the ground, that actually causes an extension force at the knee joint. The hamstring doesn't actually change length, hence why it's an isometric description at the beginning, but yeah, your hamstring in a closed chain position can actually cause an knee extension force to occur. So the other movement associated with the hamstrings then is flexion of the knee. So short head of the biceps, long head of the biceps, and our two medial hamstrings are all going to be involved in knee flexion, as is other muscles around the knee joint, including the gastrocnemius, and that can come into importance just by depending on the position of the foot or ankle. We can gain assistance from the gastrocs, or we can negate any assistance if we want to make it a little bit harder on the hamstring muscles. And we're just looking at it from a few different angles, just so you can kind of see this knee flexion movement. So how do the hamstrings work in relation to knee flexion functionally? Well, there's eccentric knee extension during the terminal swing phase of running. So like I said, as the leg is extending at the knee, then the flexors of the knee are actually trying to control that movement so you don't overextend the knee too quickly. How much they're kind of actively involved in flexing the knee during the swing phase, kind of get the foot closer to the kind of hip, is a matter for some debate. Is that due to more ground reaction forces? But there will be some aspect of kind of helping to pull the knee, or rather pull the ankle towards the hip in order to decrease the lever arm as you're swinging that leg through. Other functional aspects in relation to hamstring, well, the medial hamstrings show a selective activation during different cutting and knee stability in frontal and transverse planes, and as we mentioned previously, their role in controlling tibial rotation. So another way of kind of training our hamstrings, or one of the aspects that we'll want to include within our training protocol, is different frontal and transverse plane movements, because that will help to in particular kick in the activation of our medial hamstrings. So we're going to look at peak force angle and just kind of go through this with you. So all muscles have an optimum length for producing peak tension, and many believe that athletes who produce peak tension at shorter lengths are going to be more likely to be injured. So in a study from 2001 measuring the optimum length of athletes, the muscles of athletes who had previously injured their hamstrings, what they found was that previously injured hamstrings produced a peak tension at about 12.5 degrees less than their non-injured hamstring side, i.e. they're producing their peak force at shorter optimum length. And we'll kind of show you a couple of images to kind of help you get your head around this. So they tend to kind of measure it with kind of knee flexors. It's a little easier to kind of control some of the variables. So if you imagine what we're doing here is we're trying to assess the angle at the knee joint when the hamstrings or the knee flexors produce their kind of peak force. And so with a kind of non-injured leg, if you imagine this is the angle that the peak force is kind of being developed, and now we'll kind of have a look at how that changes with a. So what we see here with the kind of injured side is that that angle has shortened, so you're actually kind of producing it at a slightly kind of shorter muscle length and a decreased angle. You may well be producing the same kind of peak force development, but you're doing it at a different muscle length. And obviously that has implications if you are trying to produce force or hip extension force or knee flexion force with both legs at the same time, because you're going to be producing them at slightly different points. So obviously that's not great if we injure our hamstring, and that kind of alters the point at which we develop or generate our peak force. So the benefit of doing certain types of training, in this case eccentric exercise, there's a lot of study around eccentric exercise for hamstrings, because it has been reported to shift the optimum length of tension development back to longer lengths. And this shift has been shown to occur not just in the hamstrings, but also in the elbow flexors, plantar flexors, obviously the knee flexors, hamstrings, and also the knee extensors. So it's not just the kind of hamstrings that show this trait. So for our exercise kind of progression model, the application of additional stress with eccentric emphasized exercises after periods of kind of basic strength training has been achieved will help us to shift the peak force angle, i.e. getting it at slightly longer muscle length, to more optimal levels or pre-injured levels. So again, just a quick little picture to kind of so you can get your head around that. So we're looking at why we kind of do eccentric exercise for our hamstrings. The image on the left, imagine that's our previously injured hamstring, and that's the angle that we produce our peak force with eccentric training. So after a period of doing eccentric training, that angle has now shifted back to ideally where we want it to be, and that's the benefit of doing that type of training. So just a couple of kind of principles based around what we'll kind of go through during this workshop, and we'll just go through these 6. So not all hamstring injuries are the same. Stronger hamstrings are better than weaker hamstrings. Slow strength training is not the only solution. Hamstrings don't work in isolation. The importance of testing and retesting, and knowing why you apply different hamstring exercises is more important than knowing just more exercises. So we'll have a quick chat around some of these. So first off, not all hamstring injuries are the same. So we have typical and atypical injuries. So our typical injuries are going to be proximal biceps femoris injury, and then kind of distal medial hamstring injuries. So if you get those are more common. That's what we generally tend to see when we see hamstring injuries. If you have an atypical injury, so you would want to be more concerned if it didn't show that typical pattern. So if you had a distal biceps femoris injury, so an injury of the biceps femoris closer to the knee, that's more unusual, and therefore you want to be a bit more concerned about that. Or if you have a proximal medial hamstring injury, again, that's not where we tend to see our medial hamstrings get injured, so that's a little bit more of a concern. Now the problem that you get with research, if research clumps together all the different types of hamstring injuries, then you are going to pretty obviously kind of see mixed conclusions based on if they do this certain exercise or that type of program, because not all these injuries will occur for the same reason. So if you clump them all together, the research doesn't always kind of show how beneficial some of these exercises would be. Our second principle, so stronger hamstrings are better than weaker hamstrings. So stronger hamstrings can reduce the incidence, severity and reoccurrence rate. Why? Well, eccentric training will help to shift the optimum length of tension development back to kind of longer lengths. It will also help to improve the quadricep to hamstring strength ratio, which will help to ensure better knee stability. And also, as we are moving fast, which is what's going to happen during sprinting, the faster you move, the greater the eccentric forces are going to be. So it is important that the stronger we get, the better able we are going to be to kind of cope with our limbs moving at very, very fast velocities. So principle number 3, slow strength training is not the only solution. Yeah, we just said strength training is good, but you have to apply that strength as well. And since 2/3 of hamstring injuries do occur at speed, hamstring strength needs to be applied to generate more force at speed, or to decelerate at speed, or to reactively move from an eccentric to a concentric contraction. You can't just do slow strength training and expect it to automatically apply perfectly to when you're training or running at speed. So we need to ensure that this can be done repeatedly as well, so that someone has a good capacity to be able to control these forces at speed. And we also need to ensure this can be achieved in different planes of motion as well, particularly for kind of athletes where you are kind of multi-directional athletes. They need to be able to control these forces both in the frontal and transverse planes, in addition to our standard. Like a lot of muscles in the body, hamstrings do not work in isolation. So we kind of discussed this slightly earlier. Muscles that will assist the hamstrings in knee flexion are going to include things like the sartorius, gracilis, as we mentioned before, the gastrocnemius, and even the adductor magnus plays a part. Muscles that assist in the hamstrings in its hip extensor function are going to be the glutes, erector spinae, and adductor magnus as well. So other muscles to strengthen would include those ones, and also the anterior and lateral core. And then you also need to look at muscles that you may need to release, which may include erector spinae, hip flexors, quadriceps, lateral hip, gastrocs, plantar fascia, glute medius, and latissimus dorsi. So you can't just say, yeah, you've had a hamstring injury, get it stronger and it won't happen again. You may well need to try to kind of figure out what the underlying mechanisms that may have caused the hamstrings to become injured, and how that relates to different muscles. Other factors that you also may need to kind of look at would include foot and ankle stiffness, knee stiffness, and sacroiliac joint instability, as all of these things can have a negative impact on the hamstrings, and may well also lead to hamstring injuries. Test and retest. It's a big issue with a lot of kind of trainers in the fitness industry, is they don't actually test anything or retest in order to get an idea about what has worked within their program. So you don't just implement a training program without getting before and after test results. If you don't get any before test results, you don't necessarily know what you need to work on, and if you don't do it afterwards, you don't know how much it's improved or whether it has improved at all. So you need to test your hamstring. One of the things you could do, for example, is test hamstring response to the session pre and post the main session, and this can work quite well because that helps to kind of show us from a neurological perspective whether it's coped with the volume or the stress of the session that you've placed upon it. You can also look at testing the erector spinae in relation to endurance, adductor strength, abductor to adductor strength ratio. A physiotherapist may look at kind of sciatic nerve irritation, and these can all be beneficial in helping to kind of look at what needs to be worked on in addition to kind of hamstring strengthening and power and coordination. Out of the tests that you can perform, the kind of Nordic curl test, as we see with the image there, is one of the kind of classic ones. It's a very good test, requires obviously no equipment, and is an exercise that's usually kind of prescribed in addition to actually being the test as well. Like I said, it can be performed in the gym, on the field, in a variety of kind of places, and is a very good test in order to assess function. What we should be looking at is that an athlete should be able to control the kind of deceleration of knee extension. So your partner kind of holds your low legs and you try and lower yourself down towards the ground nice and slowly. That's what we'd want you to be able to achieve. And then our final principle, knowing why you apply different exercises is more important than just knowing more exercises. So, for example, how do you train some of these different muscles? Well, biceps femoris, the long head, should be involved in fast hip extension and knee flexion, and then also decelerating hip flexion, and also kind of decelerating knee extension. Exercises that are very good for working your biceps femoris are going to include the Romanian deadlift, glute ham raise, and the lunge, hamstring emphasis lunge. And then for the short head of the biceps femoris, it's heavily involved in heavy knee flexion. So again, good exercises going to include glute ham raise, Nordic curls, and leg curls. You want to work the semitendinosus. Well, that is very much involved in kind of reactive hip extension and knee flexion. So exercises that are very good for working the semitendinosus can include kettlebell swings, prone leg curl, razor curl, and the glute ham raise. The semimembranosus, less reactive, more involved in heavy hip extension and also frontal and transverse plane loading. So again, Romanian deadlift, glute ham raise, razor curls, and then also, like I kind of said, some of the kind of applied functional movements where we're going in different planes of motion are going to be good for that as well. For the adductor magnus, which we would consider our fifth hamstring muscle, again involved in predominantly hip extension and knee hip adduction. So exercises to really focus on that are going to be lunges, our prone leg curl, split deadlift, transverse step ups, and even kind of wide stance squats. So kind of sumo front squats and things like that. So strengthening the adductor magnus will help to reduce stress on the proximal tendon and the medial hamstrings, and also is going to help to reduce stress on the biceps femoris during the swing phase of gait. Strengthen the medial hamstrings in particular will help to decrease the incidence of patellofemoral injury overload. It will also help to stabilize those with anteverted hips and also help to decrease lateral knee joint overload. So a number of kind of key areas, but in particular heavily overlooked is going to be strengthening our adductor magnus. So we need to do and include different exercises within our program, because some of these although hamstrings are always involved in hip extension and knee flexion predominantly, some of these exercises are going to work some of these muscles, other exercises are going to work others. If you just do one, maybe two exercises, you're probably going to find that it's not going to adequately train your hamstrings, even if you're just looking at improving So going back to what we kind of introduced at the beginning, some of these questions about hamstrings. Well, which hamstring muscles gets injured the most? That was a biceps femoris, which accounts for about 80% of your hamstring injuries. How many hamstring muscles are there? Well, can be argued there are actually 5: semimembranosus, semitendinosus, long head of the biceps femoris, short head of the biceps femoris, and do most hamstring injuries occur at low or high speed? Well, high speed accounts for about 2/3 of hamstring injuries. How do hamstring injuries compare with ACL or anterior cruciate ligament injuries? Well, they're more frequent than anterior cruciate ligament injuries, but they are less severe. Hamstring injuries will also have a greater rate of reoccurrence. What are the risk factors? Well, the major risk factors, the big ones, are going to be an increased age, previous injury, and poor hamstring strength. How can strengthening help, and what type of exercises are prescribed? Well, strengthening, as we mentioned earlier, can reduce the incidence, severity, and the reoccurrence rate. What exercise is going to greatly depend on the injury and also which muscles are weak that need strengthening, to be honest. And then which demographic groups should maybe be targeted with hamstring specific strengthening? Well, we'd say speed athletes, since a lot of these hamstring injuries occur at speed. Younger athletes, try to limit the actual risk of them injuring their hamstrings. So if we can get to them at a younger age and get them stronger, hopefully that will help to reduce the risk of them actually having that first hamstring injury. Older athletes, since we know an advanced age does increase the risk of hamstring injuries, and those that have previously injured their hamstrings, obviously. So phases of training. So we've grouped the exercises into different phases of training, each with very integrated but slightly different objectives. Phase 1 is just our initial kind of rehabilitation, which some of your clients may or may not require if they haven't actually injured their hamstrings, but you may just want to look at preventing a hamstring injury. Again, some of these exercises and some of the things that we'd go through will still be beneficial, even if they haven't actually injured themselves. Then we're looking at a couple of phases of general preparation, one focused on more kind of strength, basic strength, and then progressing into eccentric and more single leg strength. And then we're looking at phase 4 and 5, which are more specific preparation phases, looking at kind of power and coordination and applying the strength that we've actually already developed. So module 3 is going to go through the first phases of the exercise progression model or protocol. Module 4 will go through the later phases of the exercises. And then module 5 is just going to go through the application of these exercises with example programming and different programming considerations. So the objectives of this module were to have give you an understanding of the incident rates, risk factors, pathophysiology and mechanics of hamstring injuries, and understand how researchers approach the concept of hamstring strengthening and rehabilitation using different training modalities, and also to understand how strength imbalances can affect the occurrence rate and reoccurrence rate in sports. So you want to complete the review questions for this section to ensure you've met the learning outcomes, and then move on to the next module.